Dr. Peter McCullough, it's so wonderful to have you back here with us today. I mean, you've been in this fight from the start, and despite the turmoil all around the world and varying acceleration points of the agenda, you are still speaking out so strongly against these injections. And I have to say, every bit of new evidence that comes out, you are making it known to the world. So thank you for that, and thank you for your time today.
Well, thanks for having the program. Great to be on Z Media. So much to cover, so much to update. There's simply emerging sources of information published every day. And what I've been doing is trying to bring the world the truth.
Yeah. Yes. And you've done an amazing job, Dr. McCullough. So thank you for that. This latest study that I really wanted to speak to you about, which you've been speaking about, is this the assessment of myocardial uptake at PET, CT, and asymptomatic SARS-CoV-2 vaccinated and non-vaccinated patients. Nakahara, huge news. So perhaps we can start there.
As a cardiologist, we've been searching for answers. We've seen, and record numbers of cardiac arrests in young people, athletes, and some have clinical myocarditis at autopsy, others don't. Most of them have normal left ventricular function, but something is wrong with the heart. Then this late-breaking paper by Nakahara and colleagues really filled in, I think, a lot of the answers. And they had roughly 700 people who had taken the vaccine, 300 who didn't. And they did cardiac positron emission tomography. Now, that's a test that I order when I'm looking for a diseased area of the heart. Typically, the PET scan will be positive in a zone that's not getting enough blood flow, or it's diseased. The human heart requires free fatty acids largely as its fuel source. But when the heart muscle cells change to preferring glucose, that's a pattern that there's dysfunction, metabolic dysfunction or disease, sometimes chronic ischemia. And so what Nakahara reported, which was stunning, which was nearly every person who took a COVID-19 vaccine, the heart actually began to prefer glucose over free fatty acids. The 18-FDG, fluorodeoxyglucose, lit up like a Christmas tree in those who took the vaccine. Interestingly, those who had a sore arm even had more intense changes. The people who didn't take the vaccine, they had normal PET scans. A normal PET scan doesn't really take up any 18-FDG. Now, Nakahara had patients out to 6 months after the shots, and the changes were there. So we don't know the implications. They're so broadly reaching. But what I can tell you today, it looks like almost no one who took a shot right now has a normal heart by cardiac positron emission tomography scanning.
And this is permanent damage, Dr. McCullough?
We don't know. I can tell you when there's clinical myocarditis. Now, 3 studies, Mansugian, Buren, and Mueller, and then the third one is now Levi. They demonstrate that there probably is some permanent form of damage with myocarditis. Certainly those 3 studies center in on a rate of probably about 2.5% of people who take the vaccines on each shot suffer some heart damage. Now we have a paper by a paper from Yale by Marta and colleagues showing at 9 months the heart damage is not resolving. Jenna Schauer showed huge heart damage. 2 papers in the journal Pediatrics in children not resolving. And there's also a paper from Taiwan demonstrating, again, sadly, the heart muscle is not healing itself when there is clinical myocarditis. So we have basically a wave of bad news. It looks like there's a form of a metabolic cardiomyopathy in nearly everyone who's taken the shots. About 2.5% sustained damage. Excuse me. About 2.5% sustained damage, what we call myocarditis. And that myocarditis is not clearing up. Now, what I'm seeing in my practice is I'm seeing small areas of damage that we quantify by late gadolinium enhancement on cardiac MRI. A small area would be less than 15% of the left ventricle. I am seeing some small areas resolve over time, typically more than a year of treatment. Let's say a 5% or 7% LGE pattern could resolve, but ones over 15% are not resolving. In general, when there's more than 15% of the left ventricle involved with myocarditis, the risk of cardiac arrest skyrockets. And clinically, we actually implant implantable defibrillators.
My goodness. Okay, so the people that are resolving versus the people that where it isn't resolving, is there a difference in the number of shots that they've had? Is there a particular factor that determines it more than any other?
It hasn't been adequately studied. What I've observed clinically is that small areas of damage resolve, larger ones do not. I would infer probably younger people have a better chance of resolving than older people. I have one person in my practice who previously had heart damage from heart attacks. He had a coronary bypass. He had an ICD in place. He took one shot of Moderna. Now, he's a consultant in his 60s. One shot of Moderna, and within 8 hours, he was in cardiogenic shock. He was airlifted to Emory University Medical Center, required full cardiopulmonary support, had a heart transplant, had an intercurrent stroke, an infection, very prolonged course. This is after one shot of Moderna. And you know what, Maria? He called me from Atlanta, desperate for assistance because the transplant team wanted him to take a second shot. And he was so destroyed with the first one. I told him to get out of there, which he did. He's now my patient. And that vignette's been written up by Mary Beth Pfeiffer, investigative reporter. It's been published in Trial Site News. He's given the consent to do that. Well, the reason I'm giving you that vignette is to show you in some people who previously have heart disease, how greatly they can be damaged even with one shot.
I am astounded that with all of this evidence coming out, there's still a recommendation for someone with heart damage to go and get another shot. I mean, and I want to ask you about that strange thing that's happening, because what we are seeing is so much evidence coming out. So my first question is, what do you think has changed in terms of people being willing to bring out that evidence? And then as a follow-up, why is it that so many in the medical profession still aren't seeing it, aren't aware of it? I mean, this is insanity.
We've had a few reports out in the last week or so. You've probably seen them. One report that healthcare workers and doctors are progressively declining COVID-19 vaccination. There was a report out from the United Kingdom, one in the United States. They're also declining influenza vaccine. And then more broadly, parents are now starting to decline childhood vaccinations. The CDC just reported record rates of exemptions, people saying they want to be exempt from taking the shots. So I think there are people backing away from them. But what we don't see is capitulation. We don't see people coming out, healthcare professionals, other leaders, and simply admitting they're wrong and helping others now recognize what's going on. And by admitting that one was on the wrong side of a decision, we can come clean on this and all together move forward and take care of patients.
I agree. I think that there is probably an element of fear about, coming clean. Especially, I think I can't remember the gentleman's name now, if I can call him a gentleman, but he recently said, there needs to be forgiveness. We were working with the information that we had at the time, and the public response was, no, you won't be forgiven. So this is, and to be honest with you, Dr. McCullough, I'm of the opinion, strong opinion, that those who should have known better, like, say, for example, the FDA, CDC, they absolutely can't be forgiven. They need to be held accountable in a court of law. So that is undeniable. And so, but there are, medical professionals right now who, if they came clean, lower level, we were so wrong, don't get any more injections, people would forgive them. Do you agree?
I agree. America, Australia, the westernized countries are enormously forgiving. What we don't see, though, this has been a trend in recent years. We don't see political figures ever admitting they're wrong on anything. They simply double down or triple down. I think their political advisors tell them that's a sign of weakness if they admit they're wrong. On a big public policy decision like COVID-19 mass vaccination, it cannot go on forever that there's continued support for this. I mean, in Texas recently, we've just passed SB 7, Senate Bill 7, which outlaws any more mandates for vaccines. And here we have Baylor College of Medicine in Houston mandating vaccines on students, residents, fellows, nurses, attending physicians. Baylor College of Medicine is breaking Texas law at this point in time, and they're going to have to stop. So at some point, I think there should be just a public apology that they're on the wrong side of this issue. Two major societies now calling for complete withdrawal of all COVID-19 vaccines and boosters from the market. One is the World Council for Health. They issued that advice in June 11th, 2022. And now the Association of American Physicians and Surgeons are on March 23, 2023, calling for global withdrawal. I've called for withdrawal of all the vaccines in the U.S. Senate, multiple states, as recently in the European Parliament on September 13th, 2023.
Well, I want to go into a conversation on the future for vaccines in general, because right now you have Tedros Ghebreyesus from the WHO basically gaslighting the population, telling them that there is, some incorrect information floating around where in relation to the pandemic treaty. He says, and I quote, "We find ourselves in a time where fake news, lies, and conspiracy theories, misinformation, and disinformation are rampant. There are individuals who, whether they genuinely believe it or not, are spreading false claims about the pandemic accord." Sorry, it's not a treaty, but that's what it's widely known as, that require our attention. And he says that some argue that this agreement will undermine a country's sovereignty by giving power to the WHO, and that the WHO will be able to impose lockdowns or vaccine mandates on countries. Now, multiple legal experts around the world, including here in Australia, and I'm working with some of them, have assessed what the International Health Regulations amendments, for example, say, and they say that unequivocally this does give the WHO that power. And Tedros is calling on governments to bring in new laws to basically silence anyone who would challenge these falsities that he's claiming that it's not going to give the WHO more power. They are absolutely determined, Dr. McCullough, to keep going with mRNA in particular, which these injections so far have been devastating. What are your thoughts on all of this?
Well, it's true that the WHO does aspire to have dominion over all plants, animals, and humans. And through this pandemic treaty alliance and the international health regulations, they want to memorialize it, binding by international law, to get a fair counter narrative and evaluation and analysis. You can go to the World Council for Health. Remember Dr. Tess Lowry, formerly was a very high-level advisor to the WHO. And they have a policy brief on the WHO new regulations and what they mean for the world. That's a fair analysis. We have multiple bills in the United States and House and the Senate, all calling for the U.S. to pull out of the WHO. Former President Trump has said that one of his first acts, if he's brought back into power, would be to withdraw the U.S. from the WHO. So Tedros is in trouble. Instead of trying to use weaponized propaganda terms like misinformation and disinformation, he should come out and let's have some fair discussions about this, as opposed to try to railroad the world into control by the WHO.
Yes. Well, I note some good news that on that particular X post from Tedros, I noticed an overwhelming response from people criticizing him, saying, no, you are not going to silence us. We have, consensus all around the world that this is a complete overreach. No one wants it. And I have to say, I spoke at an event just this weekend in Adelaide in Australia, and every single person is ready to exit the WHO. And quickly for the viewers, Australia exits thewho.com. Go there, put your contact details in and get involved in this movement. We also have Christine Anderson speaking very, very loudly in Europe on this issue, Dr. McCullough. So I agree with all of these people. Now, what the future that the WHO envisions and the big pharma industry, when they talk about vaccines, the flu vaccine is a perfect example of this, where mRNA is introduced now as well in Australia. We've had more something added into the childhood vaccines schedule. I think it's also mRNA. This is the way that they want to move forward, and I want to ask you, I have zero trust in this technology. Do you think that there is any chance that this will ever be safe, or have they proven themselves to just be deadly moving forward?
I've looked at it carefully. Unfortunately, the world's had a love affair with messenger RNA, a paper by Lalani and colleagues, British Medical Journal. Since 1985, tens of billions of government dollars have been poured into messenger RNA. There's over 9,000 patents on messenger RNA. The top patent holders include Sanofi, BioNTech, CureVac, Moderna, the US government, 9,000. Now, Carrico and Weissman recently received the Nobel Prize just for a minor modification of messenger RNA called pseudouridination. No single person invented messenger RNA. No one came out of their garage and can say that, wow, they invented it. It's 9,000 patents. The major, most cited patent holders are actually Young and Hoare. But the bottom line is there's been a love affair with messenger RNA. We now know in a paper by Schreckenberg from Germany that messenger RNA, both Pfizer and Moderna, is directly toxic to cardiomyocytes, heart muscle cells. They take it up. Paper by Crossan and colleagues show that in human hearts, and people who died after the vaccine, the messenger RNA is stuck in the human heart. It's circulatory in the bloodstream at least a month, shown by Castriona, stuck in lymph nodes and around the axilla and the arm where it's injected for at least a couple months. All this adds up to the fact that messenger RNA technology for vaccines is going to be unsafe. It's going to take the flu shot, which is relatively safe. It's ineffective, but relatively safe, and it's going to make it unsafe. It will also, for the RSV and all the other vaccines, it's going to make them progressively more dangerous to the population. There should be a ban on all messenger RNA development at this point in time, given the COVID-19 vaccine debacle.
And I presume you agree that is the case for mRNA in food as well?
It's true. We have a statement by the WHO in 2005 that said if vaccines were going to get into the food supply, it should come under the medicinal regulatory agencies like the FDA and the TGA. And yet our USDA has not done that. We have self-replicating RNA and DNA vaccines in pork since 2017. We don't know what the implications are. Not yet in beef and not yet in vegetables and other foods. But if you go on the USDA website, you see a bevy of projects. It's getting everybody very nervous because recently the Chinese have shown that messenger RNA can actually pass the mammalian GI tract and be absorbed.
Yes, they were talking about in Australia, and the sort of meat industry heads have not responded to me about my inquiry, because they said that as of August 2023, they were going to start doing this to all livestock in the state of New South Wales to protect from foot and mouth and lumpy skin. And we don't have these problems in Australia. There's no need to inject our livestock. I know that they did a trial, Dr. McCullough, with some sheep and some cows, some sheep specifically in the state of New South Wales. We don't know where those sheep came from. We don't know what happened to them, and we don't know where they went. And so my question is, if they were to put those sheep into a field with other animals, is it possible that shedding could occur? I mean, how much do we really know about this?
We simply don't know about mammalian shedding at this point in time. But I can tell you, I've talked to some naturopathic veterinarians, and they say with modern farming techniques and the cleanliness that we have, we actually don't need any vaccines in livestock. So in cattle, I know that there's a core pack, what's called a clostridial pack, and then a reproductive pack. In cattle right now, they're all conventional antigen live attenuated and killed vaccines, but they're simply not needed at this point in time. This is an opportunity for organic farmers and others to distinguish themselves and actually begin to label their products as being free of vaccines, free of genetic vaccines. We had a big push in Missouri, a House bill to try to force labeling. If genetic vaccines were going to be used, they'd have to label it. And that was defeated. So it turns out there's some good guys and bad guys. The good guys are the U.S. Cattlemen's Association, and the bad guys are the National Cattlemen and Beef Association. And the national group, they worked with our Democratic Party in Missouri to continue to conceal whether or not these genetic vaccines are used in our food supply.
Wow. Unbelievable. Quick mention, seeing as we're on this topic, Stockman steaks in Australia, non-GMO, guaranteed no mRNA, all grass-fed, natural, links in the description below. And I tell you what, you're absolutely right, Dr. McCullough. Now is the perfect opportunity for these types of businesses and farmers and businesses in general with conservative values, clothing brands, whatever it may be, that don't subscribe to ESG and the globalist goals, will absolutely skyrocket in this time, because the movement of people around the world to decouple from globalism is really growing. Would you agree?
I agree. With the food supply right now, I've stopped eating any pork products. I don't think they're trustable, even though the cooking and curing process probably denatures the RNA and DNA used. We simply can't know at this point in time. In terms of other GMOs, the best we can do right now is choose organic and start to really influence our farmers to help distinguish themselves, because I think they will get premium pricing in terms of offering a pure, cleaner food supply.
I agree. If we can shift the entire population to supporting pure and clean food supply, guess what? The money talks, so I think that this is the perfect time to change the world, because everybody cares about food, and we can really change the trajectory of the world. But there are a number of different issues, as we see escalating global conflict. We see an escalation of all of these other sort of weather events and everything around the world, Dr. McCullough. And as well as that, they seem to be doubling down on this over-sexualization of children. I know this is a topic you and I have touched on before, but I'd like to get your thoughts on the damage that this is actually doing to children long term. We see a lot of people coming back now and suing the advice that they were previously given to mutilate their bodies on a whim. And so where do you see this going? I mean, it's insane.
Yeah, we thought that something went wrong with the House of Medicine, kind of the medical orthodoxy with COVID-19, the failure to treat sick patients, the failure to advance, multi-drug protocols in the hospital and save people, and then pushing mass vaccination on the population, that this was all strongly endorsed by the medical orthodoxy, every medical school, every major health system worldwide. We thought maybe that was just an aberration driven out of fear, the pandemic, the emergency countermeasures. But then when the transgender crisis reared its head, we said, wait a minute, there's no national emergency. There's no worldwide gender emergency. And what we've learned on this, Maria, is absolutely stunning. That this gender crisis had been brewing in Europe for several years. Van der Meesen and colleagues reported about 15 years ago that the children coming forward for gender change were largely autistic. They had autistic tendencies, and that explains a lot, right? But what normal child would come forward and do this to themselves? And now Warrior and colleagues have tested people, LGBT and particularly transgender, and they're very high on autistic traits. And we have supportive data now suggesting that the autism epidemic, when I was a child, autism was 1 in 10,000. Now it's 1 in 36. That the autism epidemic is fueling the transgender crisis as subjects. Now, you take someone with autism spectrum disorder and say, are they suggestible? Do they feel ostracized? Are they susceptible to an influx of indoctrination by pornography? The answer is yes, yes, yes. And it doesn't look good at all. Now, on the medical side of transgender medicine, of which every major medical center supports, every single health system supports, the Endocrine Society, American College of Pediatrics, American College of Obstetrics and Gynecology, they're fully behind transgender medicine as a treatment for gender dysphoria. This is what we know. The hormones, in a paper by Santos and colleagues, make the kids sick about 59% of the time. Nausea, vomiting, headache, weight gain, acne, insomnia. It's terrible because the normal human body is not supposed to get either Lupron or androgens or estrogens. It's very abnormal. And now the surgeries are nothing less than horrifying. What we know is doing mastectomy in young girls causes contractures, scars. They scrape off all the breast tissue down to the pectoralis muscle. It's very uncomfortable. The surgeries in young women to the clitoris called metoidoplasty, or actually just a phalloplasty, which is making a false penis from a large chunk of tissue from the arm or thigh, is disfiguring, doesn't drain urine correctly, doesn't sexually function at all. And in the boys, it's far worse. The boys, the lead surgery is called the penile inversion vaginoplasty. Now, it sounds bad, and it is bad, Maria. What we know is they're slicing open the penis long ways, coring it out, stuffing it inside the pelvis as a rudimentary vagina. It doesn't drain urine correctly, doesn't sexually function, it gets infected. Castration, of course, becomes permanent. And we know, what are the outcomes here? Well, a paper in Sexual Medicine shows that going through this gender change as a child actually increases the psychiatric burden of disease, doesn't improve it. We know that now in a paper from the UK in JAMA that transgender medicine increases the risk of homicide, suicide, and death from all causes. So transgender medicine is bad medicine. No ethical doctor, nurse, or technician should participate in it. And yet they are. So in the United States, we've actually had to go state by state and ban transgender medicine in the youth. We know there's a withdrawal of transgender medicine across Europe now, so they're already pulling out in multiple countries. In Texas, we went through this battle. I assisted the Attorney General with an expert report that ultimately went all the way up to the Supreme Court. And so we've enjoyed now 2 months of no transgender medicine in the great state of Texas. Good riddance. I can tell you, as a doctor, I take care of transgender adults and LGBT. We have a broad acceptance of diversity in medicine. I think if people as adults want to pay for their own medical care and do this to themselves, that's their choice. But it is bad medicine in children, and I'm here to stop it.
Well, I'm so grateful to hear that, that there's so much action happening across the United States. We certainly need more of it in Australia. As you would know, doctors here are much more silenced than they are in the United States. We have AHPRA coming after them if at any point they would say anything that's contrary to the scientific consensus. And so I really, really hope that Australia starts to follow suit, Dr. McCullough. I want to ask you about this autism link, because we also have an autism link with childhood vaccines. That's also undeniable at this point.
It's true. It's not looking good, Maria. What we know now is there's about 200 papers showing that this hyper-vaccination, giving multiple vaccines in the same administration, is related to immune system dysregulation. And there's now roughly about 800 papers showing that the intensification of the vaccine schedule has been ecologically related to neuropsychiatric disorders broadly. And that includes attention deficit disorder, Asperger's disease, autism spectrum disorder, as well as some other motor and cognitive disorders. The vignettes of mothers, I think, are so impressive, where a child will receive 6 to 12 shots, vaccines, all in combination products at once, go home, develop a febrile seizure, and after that point in time, they're never the same. They develop the characteristics of autism. So and the converse, the analysis on the converse is amazing. Papers by Mawson, Hooker, Miller, Thomas, and an older Amish study all show going natural, taking no vaccines at all during childhood, much lower rates of the neuropsychiatric disorders, but also lower rates of asthma, atopic dermatitis, need for tympanostomy tubes, need for antibiotics, etc. So, like I say, in the United States, we have record declines now in childhood vaccination.
It's wonderful to see. And I note, and I spoke about this over the weekend, the latest data coming out of the United States, only about 2% of the population has gone back for the COVID booster. So things are looking really, really good. But I want to ask you about this going on from the previous question and going to the DNA damage that's recently come out from the COVID injections. So a lot of people don't actually understand what DNA damage is, and particularly relating to the COVID injections. So can you talk us through this entire topic, please, Dr. McCullough?
Well, there's been several emerging papers, so I want to be able to cite them. One is by Spiegler from Canada in the preprint server, and McKernan in the United States. Now about a dozen labs have reported in. Dr. Buckhalter from University of South Carolina has just testified in the South Carolina Senate. He's confirmed it as well. So this is now out. The World Council for Health has had an entire symposium on this where all the data have been reviewed. This is what we know. The vaccine vials have process-related impurities in it that are fragments of DNA. And how the messenger RNA vaccines are mass produced is the DNA code for the messenger RNA is in what's called a plasmid, a little circular piece of DNA that is out in the cytoplasm of E. coli. And so as E. coli replicate, they make more and more of the cDNA coding for the messenger RNA. And so then the E. coli are actually given antibiotics to kill the E. coli in order to basically segregate out the plasmids that are containing the code for Pfizer and Moderna. Those plasmids have embedded into, by the way, antibiotic resistant genes. That's how they're doing it. It's a mass production. It's called process 2. Okay, so when that's done, that DNA in it has a promoter that promotes a massive upregulation of the messenger RNA production. And that promoter complex is called SV40. It includes a enhancer, a promoter, and what's called an origin of insertion. It's a complex. Well, the antibiotic resistant genes and the SV40 complex have been found in Pfizer and Moderna as DNA process-related impurities. Sometimes they're above an arbitrary threshold of concern. Sometimes they're not. In the Spiegler study, they are related to adverse events, which is interesting when they create a variable called the SAE, the serious adverse event to adverse event ratio. But it should be random if it was not of importance. This has been brought to both the U.S. and Canadian authorities. They have said it's of no concern because they're low level and they don't believe they're related to anything. But this is how this fits into a broader picture of a concern about cancer. Because these are genetic technologies, and cancers are a genetic, illness by and large, certainly with respect to either inherited or spontaneous mutations, giving injections every 6 months could cause cancer. Well, how is that the case? In a paper by Anguis and colleagues, the multi-hit hypothesis of cancer with COVID-19 vaccines has been brought forward. And this is what we know. The spike protein produced from the vaccines in a modeling study from University of Pittsburgh by Singh and Singh show that it is likely to impair tumor suppressor systems P53 and BRCA, which controls female reproductive cancer. So that's the first hit. The Chinese showed that the messenger RNA fragments inhibit DNA repair of normal human cells. That's hit number 2. And now the discovery of SV40, a known tumor promoter sequence in the vials of messenger RNA. That's hit number 3. So Baylor and Sutherland published in 1984 the multi-hit hypothesis and said if we ever have an exposure, a chemical or a drug, and it has multiple hits that are oncogenic together, it's likely to form cancer. So here we go now. So since the rollout of the COVID-19 vaccines, every cancer registry is showing cancer skyrocketing.
Yep.
Both recurrent cancers of people who have a indolent malignancy or malignancy in remission and de novo cancers. We're seeing cancers that are governed by P53, including melanoma, renal cell cancer, other solid organ tumors, as well as BRCA, which is breast, ovarian, and uterine cancers. We're seeing those rise. And the oncologists have no answer at this point in time. A term has been coined, and it's very appropriate. It's called turbo cancer because these cancers progress so rapidly, some patients don't have a chance to even get chemotherapy or radiation.
Yes. So you use the word process-related impurities. And I want to ask, does this mean that it was an accident? It's accidentally causing turbo cancers, or is it possible that this process-related impurity was done on purpose?
What we've learned is that all RNA products that rely on plasmid DNA, these little circular places of DNA to crank out the messenger RNA, when the E. coli are harvested, the E. coli are killed, and then the DNA is harvested and the RNA is harvested. The DNA has to be dissolved with what's called DNA aces. And it's likely impossible to get rid of all the DNA. So there are process-related, little fragments of DNA in these RNA products. Now, in cardiology, I can use a few RNA products right now. I can use inclisiran and patirisan. These are small interfering RNA products. And the FDA, the regulatory agencies, have arbitrary thresholds for this, both on the quantity as well as the size of the fragments. But they're very arbitrary, and we don't know if they're related, to any adverse events or not until we had the Spiegler paper. Having said all this, this is more than enough information to put a halt on these vaccines and have a very thorough investigation. I think we should link all the cancer registries to the vaccine administration registries immediately and have an immediate analysis for this. We need tumors and the tumor registries to actually stain for messenger RNA, like it was done in the Crossan paper for the heart, as well as stain for spike protein. And we need an all hands on deck approach. I have to tell you, Maria, that if the vaccines are proven to cause cancer, which they're not, but if they are, I think we're going to see worldwide mass panic. I mean, 2/3 of the world took these vaccines.
And I want to ask as well then, with what is, okay, there's a few layers to my question. If it is DNA damage, does that also affect the psychology of a person? Can that change the person's apart from, cancer or other things that can stem from these actual physical illnesses, can it change the person themselves?
There are some papers written about genetic vaccination, causing psychiatric changes. That's been well described. Borovina and colleagues from Croatia described some cases of people who basically developed acute psychosis after vaccination. One person tried to commit suicide by stabbing themselves in the abdomen. They all had to be hospitalized. Separately, Seneff and colleagues, I'm an author on the paper, have laid out the rationale for how the vaccines could cause amyloid plaques in the brain. That's the most common feature that we see in Alzheimer's disease and other neurodegenerative disease. And lastly, Mortz alone in a single paper has written and described a case of rapidly progressive Parkinson's disease, leading to simultaneous neurologic and cardiac death after 3 Pfizer shots. So all of this is converging in the literature. I think the answer is yes, because the lipid nanoparticles do go into the brain. We have multiple mechanisms where it's possible that human behavior could change, not only with respect to just cognition and cognitive decline and dementia, but theoretically with respect to emotions and other aspects of human thought.
In these cases that were reviewed in these papers, Dr. McCullough, do you know if the individual was aware that there were changes in the way that they thought?
The best paper is this autopsy paper by Mortz, where the family was, observing their loved one who was in senior living, and it was, his first shot, second shot, he got progressively worse. He got to the point where he couldn't walk. Ultimately, he died of a cardiovascular collapse, had an autopsy, and there was clear evidence of the vaccine in the brain. It was affecting the blood vessels in the brain, but it was in the brain tissue as well. So this is very disturbing. There was another autopsy paper from Switzerland that showed the same thing. So as we sit here today, I can tell you as a doctor, I'm deeply disturbed, but those who took the vaccine there almost certainly is vaccine in the human brain, vaccine material, messenger RNA, and of course, the disease promoting and damaging spike protein.
I ask this because a lot of people around the world, and I know it's happening from every country because I have people across my channels, that are everywhere. And they say that they are seeing, people are becoming more intolerant, more impatient, at the same time, a lot slower in their thinking process. They seem to struggle with, simple equations even. And I wonder, and I've interviewed Dr. Seneff as well on this particular paper you referenced. I wonder whether this could be the explanation at a more widespread level, and hopefully we'll have some more studies to that effect.
Yeah, it's hard to know. I can tell you there are some neurologic syndromes that I'm very confident are as direct consequence of the vaccines, and they're largely ones where it's viral reactivation. So, for instance, former U.S. Senator Dianne Feinstein had neuroinvasive varicella zoster reactivation, or shingles, that affected the facial nerve, and it invaded the brain and was lethal for her. Justin Bieber, popular pop singer, has Ramsay Hunt syndrome, and that damages again the facial nerve, and he in his eye and his mouth, and he can't sing or perform. He's now 2 years he cannot he cannot perform. And then lastly, another neuroinvasive syndrome. This is really disturbing. First author is Karagokalis and colleagues. I'm also an author on that paper. A man in Greece took the COVID-19 vaccine shots, primary series, and developed an invasive basaloid cancer in the temporal area. It destroyed his facial nerve and the trigeminal nerve, and went right into the brain and was lethal. So this is well documented. This is published now in the peer-reviewed literature. It's searchable in the National Library of Medicine. It's probably the first case of certainly COVID-19 vaccine-induced fatal cancer. And it's interesting that it was a neuroinvasive syndrome.
Is there any way that potentially, if there is a vaccine, and I really hate calling it that, but injection damage to the brain, is it possible, or even just injection damage in general, is it possible that it won't be lethal, but it can affect the individual regardless?
It's certainly possible. Probably a lot of it's related to dose. We see such a range of syndromes, and of course, different rates of adverse events in the batches. We know this in a paper from Schmeling. About a third of people take a shot. They don't even have a sore arm. There appears to be nothing that happens to them over time. So I always ask patients, by the way, if they had a sore arm. And fortunately, about a third haven't. I've had a family member, she took 2 shots, nothing, and she's perfectly fine now, years later, and at risk for cognitive decline, and she's perfectly fine, sharp as a tack. About 2/3 have some side effects, and then about 4.2% really severe syndromes, and it's all related to the batches. So some batches must really hyperaggregate the messenger RNA or have lots of DNA contaminants. Must be some explanation for it. Other batches must have very little active product at all. So we know that's a big factor. And lastly, we've had a very big breakthrough on what's called base spike detoxification, McCullough protocol, now probably the most widely used remediation process for people who took the shots.
Yes, and that is wonderful news. You and I spoke about that the last time that we had a brief chat at the Reawaken America tour. I want to ask you, Dr. McCullough, about this term now, very long COVID. So it's gone from long COVID to very long COVID in the headlines. And, people are saying, and I think personally that this is a way to cover up injection damage in the population. The term itself sounds unscientific to me, very long COVID, but there are people that have been injected, and I've seen them on social media, and they say, I've got very long COVID. They've got anything from chronic fatigue. One particular woman, poor thing, completely debilitated in her bed for the last, I think 18 months now. And she has a couple of hours where she can even function mentally per day. Her husband's taking care of her. It is devastating. And she says that she would still rather this than have gotten COVID. So, it's insanity to me. But is very long COVID real, or is this just vaccine damage cover up?
Let me tell you, I'm seeing patients in my clinic for sure who've had COVID, and or had the vaccines, and they're sick for a couple of years. So it's a prolonged syndrome. Bruce Patterson at InCellDX has shown the S1 segment in CD16 positive monocytes for 15 months. I've asked him what he sees after the vaccine. So far, he sees full-length spike protein as long as he's observed in the samples. Brogna and colleagues from Germany shows full-length spike from Pfizer, Moderna, circulating in the blood for 6 months. And that's as long as Brogna evaluated. It could be circulating for years. If you have an abnormal disease-promoting protein in the bloodstream, Maria, people are not going to feel good. So we've seen this. A paper that caught my eye was published by Diexner and colleagues from Germany, 48,000 people with long COVID. And you know what? About 78% of it is actually from the vaccine. About 70%, sorry. 70% of, quote, long COVID people have been heavily vaccinated, and they've gotten COVID before or afterwards. So it's probably the vaccine that's making them feel sick. So I think it's a real syndrome. Our Biden administration and HHS spent $1 billion studying long COVID. Not a single new drug or protocol. Nothing to help people get through this. And that's the reason why we took this into our own hands and published McCullough Protocol Base Spike Detoxification.
Yes, I really do encourage people to have a look at that. And I note that in the UK, I saw a treatment that they were proposing, and I think they want to bring a similar program here to Australia, where they've got people going to a long COVID clinic. They put them on a VR goggle set, and they get them to do activities like golf in the metaverse, and apparently that's going to help them with long COVID. Really bizarre. I mean, sure,
Well, we've studied this. There are lists and lists of proposed treatments to do, both medicinal, over-the-counter supplements and activities. But what we found, I've been working on this for 4 years, Maria, unless we dissolve the spike protein, we actually physically have to get rid of it, people will get continue to be sick. So all the treatments that kind of cover up the symptoms, they're not solving the problem. So what we proposed is the use of nattokinase, 2,000 units twice a day, which dissolves the spike protein, bromelain 500 milligrams a day, and then curcumin 500 milligrams twice a day, which really in randomized trials helps manage the inflammation of the spike, fragments. And that combination together is a low-dose combination products. You can get them through a whole variety of sources. Wellness Company has spike support. That's probably the most widely used. And our clinic now, we have a combination product, BSD, it's all in one capsule. But the bottom line is we have to do that for 3, 6, 9, or 12 months. And then other things to actually handle the symptoms. And so N-acetylcysteine, nicotine, sometimes ivermectin or hydroxychloroquine plays a role, colchicine, but it's all on top of the base. It's base spike detoxification. Then we can work on these other aspects of care. We are seeing people get better. Thankfully, the neurologic symptoms are very responsive to base spike protein detoxification, headache, sleep disturbance, tinnitus, the POTS or posterior orthostatic tachycardia syndrome, seeing great results with that. We're doing the best research we can. We're unfunded, keeping case report forms, careful observation. I held a call for the UK recently, and the doctors, thankfully, are all reporting positive results with base spike protein detoxification. Go to my website, petermcculloughmd.com. That'll lay out the protocol for you.
Wonderful. And the link for the Wellness Company as well is in the description below for the viewers. Did you say nicotine?
Yeah, nicotine. Dr. Brian Artist, who's an entrepreneur here in Dallas, has forwarded that idea. But it turns out nicotine patches may offer some relief. Low dose naltrexone. Some have tried gabapentin. All those things can be tried. Intermittent IV therapy. But I'm telling you, I'm not seeing people get better unless the spike protein is handled with detoxification.
That's really interesting considering, I just find it fascinating. They found, I recall a study, and you probably know it, where smokers experienced the lowest levels of COVID across the world. It's
It
really
was
interesting.
paradoxical, yeah, but it's paradoxical, but it's interesting. Smokers had the lowest levels of, of ACE2 receptors too. So it's simply enigmatic. The syndrome's enigmatic. Even those who are immunocompromised, by the way, actually do pretty well with COVID. Remember, we give steroids, and they actually make the person immunocompromised as a treatment. So the COVID and the damage was almost a manifestation of a hyperimmune response. Dr. Chetty in South Africa called it actually hypersensitivity response in the lungs. It was interesting he used that term to describe it. Having said that, COVID's behind us, Maria. The fall outbreak of EG5 and FL 1.5 and HV, it's on the way down. It was a very diverse but small outbreak. The boosters were completely missed the mark on XBB 1.5. And as you said, basically, people aren't taking the boosters now. They're just laying on the shelves. Nearly all the vaccine mandates have fallen. And people want to move on. People want to move on from COVID. They don't want to be. And see our CDC director, Mandy Cohen, promoting more COVID vaccines. If someone's following her directions, they're on their 9th shot.
We have had multiple headlines just in the past week here in Australia about health authorities calling for the return of mask mandates ahead of Christmas because they think there's going to be some sort of a COVID outbreak during Christmas. And apparently the cases, the hospitalizations for COVID are skyrocketing across Australia, as you've spoken about. And there's a paper here as well that I have, which you've shared. This was actually the Daily Clout report 90. Pfizer's post-marketing surveillance shows mRNA vaccinated suffered thousands of COVID cases in the first 90 days of the rollout. So basically, and this is what you've been saying from the start, no more injections. But at this point, Dr. McCullough, as you said, COVID's behind us. What are they doing trying to resurrect these mandates, these mask mandates, ahead of Christmas, of course?
Well, they're ramping up fear. First, remember, public masking was found to be ineffective by the Cochrane analysis. Over 80 studies, public masking doesn't work. Even our CDC doesn't say to do that. Our CDC says only wear a mask when a doctor or nurse goes into respiratory isolation. So we simply don't need masks. Now, the cases of COVID in the hospital, that's simply a product of testing. If the hospitals go back to testing people indiscriminately, they will generate cases. Remember, someone stays positive on the COVID test for many months after they've had the infection. So unless they're adjudicated cases for COVID pneumonia, they really should be ignored. In the United States, they were testing every woman coming in for labor and delivery, whether they were sick or not. And this has been going on forever now. And all the studies show it's always 5, 10 to 15% of normal, healthy women delivering babies test positive for COVID-19. So the hospital case type of reporting right now is simply not reliable because it's not adjudicated. Most people are having second and third infections. But your point is, the more shots that are taken, the more likely they're going to be positive for COVID. And that was shown by the Cleveland Clinic in a paper by Shretha and colleagues. So it backfires. The more shots that are taken, the immune system is actually distracted or weakened, and the more likely they are to get COVID.
I was just on your point before about, the PCR test. I just got word again from Adelaide that there is a particular nursing home, and I wish I could remember its name now, that ordered that everyone be subjected to regular testing again. And as a result, all these faulty results are coming through, and so they have returned to no visitors, these elderly patients again having to mask up, not see their loved ones. It is insanity that at this point this is still happening. And I guess I want to circle back to the point, Dr. McCullough, of this is really a product of the World Health Organization and their poor advice. And what in the last few minutes that we have, what does the world really need to do moving forward? For me, it's exiting the World Health Organization, taking the country's health advice back into its own hands, and, quite frankly, propping people like you and doctors who have common sense up and trusting, maybe you can start, maybe you can be the new World Health Organization, Dr. McCullough. I don't know.
Well, you're right. The World Health Organization should be dropped. It's clearly at this point in time compromised by by China, by the Gates Foundation. It's an NGO. It's not an elected entity anyway. Everyone should pull out of the WHO. And that was my testimony in the European Parliament on September 13th, 2023. Pull out of the WHO. An alternative is the World Council for Health. It's a grassroots organization. It has dozens and dozens of local countries. It's decentralized. Power should be returned to the patient and the doctor in the doctor-patient relationship for sure. As a practicing doctor, I wouldn't follow anything that the WHO advises. Now, I'll look at analyses, I'll look at data, various definitions, in vitro diagnostics. I'm not saying the WHO is all bad, but they should have no influence on the conduct of healthcare, and certainly have no influence on pandemic response. They completely failed on pandemic response. So did the major government agencies. The next time there's a pandemic, and we probably will have one, it should be up to doctors in the field to decide what to do, and they should be free to collaborate with no shackles on communication. We should never have any pressure or coercion, threat of reprisal for doctors innovating and collaborating in the field. By the way, it's doctors and nurses that treat patients, not the WHO or these regulatory agencies.
Or the chief health officer of New South Wales who'd never treated a COVID patient in her life telling us how to treat it. You said the words, we'll probably have another pandemic. I agree. I think that they'll continue to manufacture these situations. They've already told us, that more pandemics are coming. And you made the statement that the WHO is compromised. I would agree. When you have an organization that's funded largely by Big Pharma, it's in their best interest to keep pandemics going. So none of these organizations can be trusted, Dr. McCullough. Well, final question for you. You travel a lot. You go around the world a lot. Do you think that people are starting to realize this, and the world is really looking like we can actually get out of these globalist organizations and start to rebuild something more positive?
They certainly are. I don't think we should look to any president or premier or senator or congressman to lead us. People are going to lead themselves. They're doing their own research. They're making their own decisions. The next pandemic, by the way, probably will be another respiratory virus similar to COVID. There's too many of these biological biolabs out there producing these infectious and dangerous organisms. Sooner or later, another one's going to leak out. The best thing to know about is the use of virucidal nasal sprays and washes, dilute iodine, xylitol, colloidal silver for the nasal sprays, scope or Listerine with hydrogen peroxide or iodine for the gargles. Wellness companies got a great medical kit, a survival kit with various key medicines, about half a dozen that one would need to initially survive a wave of a pandemic illness until we can get our bearings. Everybody's going to be ready this time. And, things won't get too far out of control if people are assertive. With COVID-19, we were behind for a considerable period of time. Remember, McCullough Protocol wasn't published until August of 2020. Great Barrington Declaration and the Association of American Physicians and Surgeons Home Treatment Guide, they were published in October of 2020. That's fully 6 to 9 months behind. Not the case this time. We're going to be way ahead of them. And it's the public that is going to determine its own destiny, not a globalist agenda. And we've seen the downfall now of public health, as well as an overreaching governmental bodies. And people have had enough, and I just don't think they're going to take it.
I agree with you. Dr. McCullough, and certainly thanks to you for everything that you've brought out that is true and factual, and separated from the hype of the people in medicine who just can't think beyond their fear. So we are so grateful for you. I encourage people to go to your Substack, and that's up on the screen right now. Stay in touch with Dr. McCullough via his X account. Any other places that you want to mention?
Sure. Go to my website, petermcculloughmd.com. That'll take you everywhere. My Courageous Discourse Substack, one of the top medical Substacks. Remember the McCullough Report, very popular in Australia, all over the world. That comes out on Saturday, Sunday. Then it's on the Apple iHeart Podcast Network. My book, Courage to Face COVID-19, suffered 2 weeks of being banned from Amazon on a bogus claim of offensive content, was restored because of pressure from the public and social media. Got to pick up a copy of Courage to Face COVID. Go to couragetofacecovid.com. And I can tell you, I'm going to be with you for the long haul. This is the rise of independent media, and we're going to see how strong people are in terms of defending their own civil liberties, particularly freedom of speech, as we move forward.
I agree with you, Dr. McCullough. Thank you so much for all of your work, and your courage is contagious. If there's anything that we need to be infectious, it's courage. So we
Right.
thank you for yours. God bless you. We'll see you soon.
Thank you.